We were just, as I mentioned, listening to U.S. President Donald Trump address reporters, making a substantial announcement, one that basically conveys the idea that the United States, he says, the president says, will stop or halt funding of the WHO, saying that the WHO, or alleging that they had minimized the threat early on and, quote, sided with China. I want to bring up a few statistics or a few sort of facts alongside this. The WHO has received a lot of criticism over the years, especially where China is concerned. It has fought the inclusion of Taiwan, for example, on the advice of China in a number of matters that the WHO addresses. It has also received some criticism in the Canadian context. On this program, for example, last evening, Alberta Premier Jason Kenney leveled some criticism against Dr. Theresa Tam, the Chief Public Health Officer of this country, saying that she was repeating talking points of the People's Republic of China when she said early on in all of this, back in January, that there was little evidence of human-to-human transmission. That is something that China was saying at the time. The president, however, did praise China quite a bit in the early days, particularly in January. He tweeted, for example, China has been working very hard to contain the coronavirus. It will all work out well. That's what he said at the time. He also has talked about defunding. He wanted to cut funding to the WHO in half back in February. So the concept is not new, though the reasons put forth as they relate to the pandemic are new from the president. He had signaled last week that he was considering something like this, but this announcement today basically formalizes it. Again, my understanding is this amounts to about $400 million of funding. Lots of questions about how it might impact the WHO's ability to conduct itself and perform the tasks that it says it has to over the coming days, weeks, and months as they relate to COVID-19. But we will look to get some of those answers and bring them to you. In the meantime, let's talk about some of the criticisms leveled, not just from President Trump, but others. What influence does China hold over the WHO? David Mulroney served as Canada's ambassador to China from 2009 to 2012. He's now a distinguished fellow at the University of Toronto's Munk School of Global Affairs and Public Policy. He joins us from Toronto. Hi, Mr. Mulroney. Great to see you.
Good to see you, Vashi.
I appreciate you making time for us. Let's just start off there. We had intended to talk to you in more general terms about some of the criticisms of the WHO where they pertain to China. We didn't know that the president would be announcing just minutes ago that they're going to withhold funding. What is your immediate reaction to that?
Well, you could see it coming, and American frustration and the president's frustration are justifiable. In the early days of the crisis, in January of this year, for example, the WHO was largely using China's own words, China's own talking points to describe the situation. And they have continued in this vein to essentially promote a Chinese message when really their job is to convey information. Now, in the past, the one problem we face is that the WHO relies on the information provided by member countries. And if that information isn't very good, it suffers. And we saw this happen in SARS when China provided unreliable information. But the difference during SARS was that the WHO took them on and was very critical of China and held them to account. What's happened now is China is still providing unreliable information, but the WHO is no longer willing to hold them to account. So we do have a big problem.
I wanted to ask you, because I'm certainly not an expert on this. I've done as much reading as I can about the WHO, about China's influence. But what I would note is not, it's not just the WHO who have hesitated to criticize China. In fact, as I pointed out just a bit earlier, the president a few months ago was singing China's praises on its response. The Canadian government has lauded the response as well. Many governments, the lines we were hearing a month and a half ago, was that the Chinese response was sort of a model response. What do you think is going on there?
Well, I think there is. You're right. There's a larger problem in that people have been either inconsistent or, frankly, cowardly in their failure to hold China to account. And it's, I think, a misguided view that by flattering China, we'll get better behavior from China. The reality is that, what was happening in Wuhan in December was that there are, very courageous and heroic doctors and medical workers. China had put in place a response mechanism in the wake of SARS that was working at the medical level. So you had the folks in the hospitals in Wuhan, which is the major city of Hubei province, who were doing what they should. They were identifying this problem. But as soon as it went up a level, up to the level of the province of Hubei, they said, no way we're going to pass on bad news to the center, and they sat on it for a long time. And they also imposed restrictions on what kind of cases they could count as COVID cases. So we lost precious weeks in terms of getting the information that we needed. This is a health problem. It's a WHO problem, but it's also baked into the Chinese system. Because again and again, think of the tainted milk scandal before the Olympics, when local officials wouldn't tell the center that milk had been contaminated and babies were dying. Think of the shoddy construction that killed people in the earthquake in Tibet. You go all the way back into the late 1950s when millions starved because local officials didn't provide reliable information. So that's always been a factor in China, but now China's globalized and has a real impact on all of us, and we're seeing that to our great cost right now.
I want to ask you a bit more about the sort of tangible effect of that, because at least politically speaking, one of the main criticisms that's being leveled at anyone who kind of believed the line that China was exhibiting model behavior was that it should, if we had been more alert to the truth, the borders would have closed faster. In fact, though, I looked through the statistics today, and Health Canada provided them to me. Only 10 cases of COVID-19 in Canada are from people who have traveled from China. At the same time, we had the Minister of Procurement on earlier talking about the immense challenge China has created when it comes to supply chains and procuring things. So from your perspective, what do you think the tangible impact in this country of not getting a full picture of China's behavior in all of this has been?
Well, first of all, there's the impact of not getting essential information, not being able to make policy on the basis of facts. And then there's the larger problem that you point to of our supply chains depending so heavily on China. Now, in the event of a national emergency, you've got to have centralized control of critical materials. Even within NATO, the North Atlantic Treaty Organization, they've been talking about things like national resilience. So one of the things that this crisis is showing us is that Canada and other countries just don't have that kind of national resilience, and we depend on partners like China who are not entirely reliable.
What do you think the lesson from that is? I just anecdotally speaking, there's a big conversation, I think, that has resulted from everything we've witnessed, insofar as people are certainly looking domestically now at what the capabilities, whether it be manufacturing or along those supply chains, are. What do you think the lessons of the experience of the last 3 months should be?
Well, I think there are lessons on two levels. So one is at the level of healthcare. We should have learned this lesson after SARS. And as I was saying, at least some of the mechanism was in place in China, but it wasn't allowed to operate fully and as accurately as it should. So we have a problem there. I don't necessarily believe that simply suspending funding for the WHO is going to do the trick. I think we need to hold the WHO and China accountable. We need the World Health Organization because we live in a globalized society where people leave Wuhan one day and they're in Vancouver or Toronto the next. We're globalized, and we need some kind of reliable health system, and we clearly don't have that quite right. But the larger problem for Canada is not just a health problem or even a China problem, it's a global problem, because China is much more influential in global bodies like the WHO, like the UN, bodies that we really depend on as a middle power and that we help to create. And as those are skewed by China's influence and in some respects corrupted. We've seen some of this, for example, when the UN tries to look at things like human rights or rule of law, and it does so in partnership with China. You know what the result is going to be. So we're going into a world where the United States is acting much more unilaterally, but where the multilateral world that we used to depend on is also a lot less reliable. And we've got to do hard thinking that I don't see us doing right now.
What does that line of accountability look like? If rather than totally withhold funding, let's say that the objective is to hold the WHO, to hold China to account, what does that look like?
Well, one approach might be to say that the United States and its allies, Canada included, but a broad coalition of countries, are going to impose and maintain travel restrictions on countries that have proved unreliable when it comes to providing statistics. And only after they have shown their reliability, and only after they've dealt with some of the problems that impede the accurate reporting of health problems, will we open that? China is susceptible to pressure like that. China is also susceptible to broadly based criticism from a coalition of countries, not just the United States, because as we've seen, they've turned that into a Sino-American kind of squabble. But because our own system is breaking down, the United States is more unilateral, everyone's tending to go it alone, we're not capable of mounting that response. And it's absolutely essential for a crisis like this.
Before I let you go, Mr. Mulroney, I'd be remiss if I didn't mention the two Canadians, Michael Kovrig and Michael Spavor, who remain in detention in China. My understanding through the reporting of the Globe and Mail is that because of the situation in jails where COVID-19 is concerned, they haven't been able to access any visits. Nobody has been able to access them. What is the latest information that you have on their cases?
Well, I'm going on the basis of the same information, and this is remarkably cruel on the part of China. Not only do we have to deal with the fact that their detention is so spurious and so unlawful, but they're unwilling to sit down with us and do just the practical thinking it would take to give us a level of reassurance that these two guys are okay. So this is, again, China turning the screws on us. And again, it's a reminder of how unsatisfactory the current state of affairs is. One of the problems, though, Vashi, I worry about is, again and again, our own officials use language that tends to flatter China, that tends to veer towards euphemism rather than facts. You can't get a country right if you don't even have the basic vocabulary for describing it. And until we have the courage and the clarity of thought to do that, we're going to be floundering as we are now.
To play devil's advocate for a second, Mr. Mulroney, when asked or when pressed about that, the federal government often talks about navigating the difficult relationship and I guess sort of explaining the posture that they've taken insofar as their intent is to secure what's best for Mr. Kovrig and Mr. Spavor and the relationship between the two countries. What would your response be to that?
My response to that would be there's a tendency to confuse diplomacy with flattery. You can stick to the facts, and you can do that without insulting China, but you don't have to say things that are beyond what you know to be true. And you don't need to flatter China. Time and again, if we just stuck to the facts and didn't say that, for example, China's response has been commendable, or we didn't say things about China's approach to human rights or the other problems they face, we simply describe the situation as it is, we'd be in a much better place. But our tendency, the government's tendency to do this, the only people it fools is Canadians. And they've got to find the courage just to stick to the facts, not flattery, but facts.
Okay, I'll leave it there. Mr. Mulroney, thank you so much for your time this evening. Really appreciate it, as always. Good to see you again.
Thank you, Vashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.